So let's understand about the hormones, common hormones which are asked in the exam. The highest controlling center is hypothalamus. It is above. Then the next important is a pituitary gland. This you can see a pituitary gland. It is situated here. Pituitary gland. Now what it has got? It has connection with the hypothalamus. The location of pituitary gland is in a sella turcica, which is within the sphenoid bone in middle cranial fossa and is surrounded by. So pituitary gland has got this anterior and posterior. You can see this is anterior and this one is posterior pituitary. So hormones, whatever thyrotrophin releasing, gonadotrophin releasing, all releasing hormones are released from the hypothalamus. They pass an order to the pituitary. The pituitary acts, and this is anterior pituitary. So now anterior pituitary is this one. This one is anterior pituitary. It secretes from this order by growth hormone, thyroid stimulating hormone, melanocyte stimulating hormone, adrenocorticotropic hormone. This is adrenal. It's acting growth, thyroid, melanocyte, adrenal cortex, prolactin, FSH and LH. So these are the important hormones which are stimulated and they target the different organs. That is anterior pituitary. Posterior pituitary releases ADH and oxytocin. So ADH is also called as vasopressin. So these are the important hormones. Now growth hormone acts for growth of the cells. So after maturity, it leads to increased growth hormone leads to acromegaly. Thyroid stimulating hormone, it is acting on the thyroid gland. Thyroid secretes T3 and T4 after stimulation of this. Parathyroid, it has got itself parathyroid which secretes parathormone. Parafollicular C cells of the thyroid secretes calcitonin, and vitamin D is formed because of from the skin. First cholecalciferol is converted. So these are the different organs: thyroid, parathyroid, kidneys, stomach, then ultimately pancreas, even liver, lungs. They are all acting in the form of hormonal action. We will be studying now about basically adrenal cortex and medulla. This is adrenal gland. There are two adrenal glands sitting on the top of the both kidneys. It has got three layers. Outer layer is called as adrenal cortex, which has got three layers. Cortex has got three layers and medulla is in the center. It is also labeled as GFR: glomerulosa, fasciculosa, reticulosa. So these three layers. Glomerulosa is concerned with the mineralocorticoid which secretes aldosterone. Minerals means sodium, potassium, and all this. These are the minerals. Fasciculata secretes cortisol, also called as glucocorticoid, basically concerned with the glucose and all metabolism. Reticulosa is sex hormone. So remember is by salt, sugar, and sex hormones. SSS, sugar is second. So glomerulosa outermost is aldosterone. This is controlled by adrenal ACTH, adrenocorticotropic hormones. It acts on the cortex to stimulate and release. Now, how does this happen? If aldosterone, cortisol, let us see first cortisol. Increase cortisol. It can happen in which conditions and what is the term called? Cortisol is increased means it is Cushing's. Cushing's. Now what happens in Cushing's? It can be iatrogenic because of use of steroids, more steroids. Non-iatrogenic, any pituitary tumor Here pituitary tumor is there, which is secreting ACTH, stimulating more cortisol to release. So that is pituitary tumor. Then any problem inside the cortex itself. Here there is adenoma or something is there that is secreting more adenoma, cortisol, or it can be carcinoma, any tumor. So it can be in the cortex, adenoma, carcinoma, or all outside the cortex, pituitary adenoma. There can be tumor in the pituitary gland which is stimulating more release, or there can be ectopic hormone secretion, ectopic ACTH, not from pituitary. So that is it leads to Oates cell carcinoma, bronchogenic carcinoma, thymic tumor, medullary carcinoma of thyroid, islet cell tumor. They secrete ectopic ACTH which stimulates to release more cortisol. All these leads to what are the clinical picture? What will happen because of this? Clinical picture will be increased cortisol leads to increased blood pressure, increased sugars, that leads to diabetes mellitus, and you see obesity, buffalo hum, moon face, hirsutism, more hairs, and may lead to osteoporosis and all this. Osteoporosis. So how it is diagnosed? Patient is having cortisol, Cushing syndrome. So you measure plasma cortisol, whether it is raised, 24 hours urinary cortisol. One test is called as dexamethasone suppression. So what you do in this, 2 milligram of dexa, 2 milligram oral dexa is given, and morning cortisol is measured, and if suppose there is no change, means this has to be negative feedback. If you give dexa, it means this should stop. If source is administration Cushing's disease, so morning cortisol, plasma ACTH raised. So here what you see following, no change in morning cortisol level. This is DEXA suppression test. And plasma ACTH level, again ACTH, this is cortisol level, then you measure ACTH level following giving corticotropic releasing hormone CRH in Cushing's disease. But if source is ectopic, pituitary, adrenal, cortex, or if source is ectopic, if ectopic source, ACTH will be raised, because after giving this ACTH should go down. If source is not this, then it will be. Now pituitary and adrenal cortex, CT or MRI. So the treatment is you do transphenadol, pituitary excision, bilateral surgical resection of ectopic tumor. So this was about pituitary gland and adrenal cortex. Now coming to another important if you see same thing in second hormone important is aldosterone. It is a mineral corticoid. If it is increased, the name is called as hyperaldosteronism. or it is also called as cons 2n. So that leads to increase sodium, decrease potassium, and increase water. So potassium, along with potassium there is decrease hydrogen and increase water. So this leads to neonatal edema, so weakness, hypertension, again that may lead to increase blood, hypertension is there, blood pressure is increased, metabolic alkalosis, aldosterone is raised, plasma renin is reduced. Again then there can be adenoma, potassium sparing diuretics are given because potassium is already lost, so spironolactone is given in this. So this is about increase of cortisol and increase of, when both these hormones are decreased, the opposite situation is Addison's disease. This is called and what is Addison's? Both are decreased, cortisol and aldosterone. That happens in insufficiency, iron insufficiency, maybe because of sudden and steroid withdrawal. This occurs when there is sudden withdrawal, or it can occur in tuberculosis, HIV, hemorrhage, sarcoidosis, ketonazole, rifampicin. The drugs, they may lead to sudden withdrawal, and deficiency will lead to again hypotension, because this has got a opposite effect. So low BP, sudden loss of blood pressure is going down, patient is in shock, so you give treatment is ACTH measurement, it is raised, and synactin. After giving ACTH, what is synactin test? You give ACTH, and if suppose patient is having deficiency primary, then Addison's patient does not show rise of cortisol after administration of synactin. That is called a short synactin test. Now treatment is you have to give IV fluids. This is Addison's crisis, and inotropic and support hydrocortisone. This was about adrenal cortex. When the hormone which acts on adrenal medulla, these are called as catecholamines or chromaffin cells. These are 10% rule is there, 10% external, 10% bilateral, 10% multiple. So the medulla, what does they secrete? They leads to uncontrolled hypertension. So medulla secretes adrenaline, non-adrenaline, leading to uncontrolled hypertension. Increase blood pressure in pheochromocytoma. Pheochromocytoma. So increased blood pressure, diabetes, sweating, associated neuroosteosarcoma. Blood picture is adrenaline increase, non-adrenaline increase. So what you measure in this? Vinyl mandelic acid. This is the question, 24 hours VMA. It is also measured by MIBG scan. MIBG scan. This is another question. Iodine level to see extra adrenal lesion, CT scan and all that. Adrenalectomy treatment, alpha blocker phenoxybenzamine, beta blocker propranolol, sliding scale for insulin if patient is diabetic. So this was the hormonal regarding adrenal glands.